For more information about the updated certification exam for alcohol and drug counselors, please visit my website at lcdcexamreview.com. Hello everyone, and welcome to the next presentation for the 4 performance domains for alcohol and drug counselors. In this presentation, I will talk about the next task in performance domain number 1, engagement. Addiction counselors play an important role in providing clients, families, and community groups with information about the risks involved with the use of alcohol, tobacco, and other drugs. But they also play an important role providing information about the available prevention, treatment, and recovery resources. In order to engage our clients and their significant others into the treatment process, we want to use a culturally responsive interview method. The acronym is LEARN, and it stands for Listen, Explain, Acknowledge, Recommend, Negotiate. Listen to each client from his or her cultural perspective. Avoid interrupting or posing questions before the client finishes talking. Find creative ways to redirect dialogue. Take time to learn the client's perception of his or her problems, concerns about treatment, and preferences for treatment and healing practices. Explain the overall purpose of the interview and intake process. Walk through the general agenda for the initial session and discuss the reasons for asking about personal information. Remember that the client's needs come before the set agenda for the interview. Take time to address questions and concerns expressed by the client, even if you don't cover every intake question. Acknowledge client concerns and discuss the probable differences between you and your clients. Take time to understand each client's perception of illness and health. Recognize, when appropriate, the client's healing beliefs and practices and explore ways to incorporate these into the treatment plan. Recommend a course of action through collaboration with the client. The client must know the importance of his or her participation in the treatment planning process. Clients' assistance, beliefs, and traditions can serve as a framework for healing and treatment. Keep in mind, not all clients have the same expectations of treatment involvement. Some see the counselor as the expert, and they desire a directive approach and have little desire to participate in developing the treatment plan themselves. Negotiate a treatment plan that includes the client's cultural norms and lifeways into treatment goals, objectives, and steps. Once the treatment plan is implemented, encourage regular dialogue to gain feedback and assess treatment satisfaction. This process increases client willing to engage in treatment and to participate into the treatment plan and continuing care recommendations. Respect the client's culture. The competencies for this task, for the engagement task, is to provide education both formal and informal about substance abuse prevention and treatment programs and the recovery process. In order to help people from multicultural backgrounds, we need to keep in mind the cultural differences among diverse communities, cultural differences in substance use behaviors, delivery of educational programs that are culturally relevant, research and theory on prevention of substance abuse problems, learning styles and teaching methods that we can adapt to our clients, how to facilitate discussions in a safe and respectful environment, how to prepare outlines and handout materials, How to make public presentations to deliver the information effectively. Cultural issues in planning prevention and treatment programs. Age and gender differences in substance use patterns. Culture, gender, and age-appropriate prevention, treatment, and recovery resources. And awareness of our own cultural biases. We must be able to describe the risk and protective factors that increase and decrease the likelihood for an individual, community, or group to develop a substance use disorder. Our knowledge in these areas includes risk and protective factors for the onset of substance use disorders and how to present the issues from a non-judgmental perspective. We also want to be able to describe the warning signs, symptoms, and the course of substance use disorders. We must be familiar with the continuum of use and abuse, including the warning signs and symptoms of a developing substance use disorder, and the current Diagnostic and Statistical Manual of Mental Disorders, DSM, categories and other diagnostic standards associated with the psychoactive substance use. We also want to be able to describe how substance use disorders affect families and significant others, and we need to educate our client about how psychoactive substance use by one family member affects other family members or significant others. The family's influence on the development and continuation of a substance use disorder, and the role of the family or significant others in the treatment and recovery processes. We want to be able to describe the continuum of care and resources available to the family and significant others. So our goals are to present available treatment options, including local health, allied health, and behavioral health resources. Motivate both family members and the client to seek out resources and services from the full continuum of care. Describe different treatment modalities. Identify and make referrals to local health, allied health, and behavioral health resources. Keep in mind the difficulties families and significant others go through when seeking help. We must work from a strengths-based principle, which emphasizes client autonomy. Describe principles and philosophy of prevention, treatment, and recovery. We must be familiar with the models of substance abuse prevention and treatment and recovery from substance use disorders. Understand and describe the health and behavior problems related to substance use, including transmission and prevention of HIV, AIDS, tuberculosis, sexually transmitted diseases, hepatitis C, and other infectious diseases. Awareness of our own biases when presenting the information. These are the things that we must be able to do and that we need to be aware of as counselors. And finally, we must be able to teach life skills, including but not limited to stress management, relaxation, communication, assertiveness, and refusal skills. Delivering educational sessions is very important because the counselor is going to be dealing with the client and the family, but also the community. This is the end of the presentation. Thank you very much for watching. Don't forget to subscribe or leave me a question or a comment, and visit my website at lcdcexamreview.com for more information about these new changes in the certification exam for alcohol and drug counselors. Thank you very much.